Hey guys, it's Dr. Justin Marchegiani here. Hope everyone is having a fabulous day. We'll be diving in, answering a couple of your questions. Really excited. Before we do, make sure you smash that like button. Really helps the YouTube algorithm. Put your comments down below. Let me know what you think. Also, you make sure you hit that bell so you get notifications of all this great content coming your way. All right, so what's happening? I am long due for a haircut. And with all the craziness and everything still being shut down, this thing's going to go out a little bit longer. So we'll see. I need a lot of product in here to keep this thing in place. So we'll see. All that collagen, man, it really makes your hair and nails grow a lot faster. So my big plug for high quality proteolytic kind of peptide form collagen really helps hair, nail, and skin and joints. One of my favorite supplements and biohacks. So what's happening, guys? Let's dive into some of your questions. Dr. J, question for the day. If you can, what treadmill do you recommend? Do you own for walking while working? Okay, so I use Rebel Desk. Rebel Desk is a good one. And I walk about 2 miles per hour. I walk about 3 to 4 hours a day. And then I have my little QB over here. So when I sit, I'll like pedal that kind of in the background. So I get on average, about 15 to 18,000 steps a day, which is pretty good. It's about a little less than 10 miles a day. So if I sit down, I'm pedaling. If I'm standing up, then I'm doing that. And maybe, a little bit here and there, I'll just be pausing and relaxing. So I like that a lot. Rebel Desk is a good one. I'll put an Amazon link in the chat here so you guys can come back to it. I'll put an Amazon reference link in the chat in the video. It's another one, though, that has the wireless control for the speed. It's a new one that's out. It's a smaller one, but the Rebel one's been my go-to for like over 3 years. So the thing has got distance. What can I do to heal my gut from a gastritis when my house burned down December 2019? I'm back in the ER, vomiting, morphine, IV, still get nausea, help. Well, I'm sorry about the house. That sounds stressful. So, is the gastritis from the stress of the house? And I imagine probably living in an apartment right now. Hopefully the home warranty, homeowners insurance covered all that. That'd be stressful if it didn't. But kind of knowing the timing about it, I would just follow the 6 R's. So I'd kind of look at your diet and see what foods are in there, and I'd at least move to a paleo template or an autoimmune paleo template. No grains, legumes, dairy, maybe even no butter, maybe even on the autoimmune spectrum, right? No nuts, seeds, nightshades, or heck, that's a good start. And then depending on that, we may add in some digestive support, enzymes or acids. If acids create any irritation at all, we pull that out. We lean more on enzymes and some gentle digestive bitters and some nice healing nutrients like L-glutamine, DGL, slippery elm, licorice. Those are really good first steps. Now, there could be other underlying infections and hormone issues. You may want to get a little bit of testing for to dive in deeper, but that at least gives you a good first step. I hope that helps. Is apple cider vinegar good for stomach acid production? It is. It's not going to be like if I take it's a good intro level. One, it's going to stimulate digestion. Two, it's acetic acid, right? Apple cider vinegar is acetic acid. It's got a low pH of around 2.5. So that does kind of lower the pH in the intestines or in the stomach. Why is that important? Because a lot of enzymes are pH sensitive. So you have to lower the pH, acidify it to get those enzymes activated. So it starts getting the digestive juices, the enzymes going. It makes it inhospitable for bad bacteria to grow. But again, some people need a more therapeutic level than maybe what you can get in a tablespoon or so of apple cider vinegar. That's where taking betaine-HCl and even taking supplemental enzymes is very, 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 very helpful. Apple cider vinegar is like a good intro way. Like I tell patients, if you start feeling a little bit better with your digestion because you're adding ACV, apple cider vinegar in, it tells me that we probably are a little bit hypochlorhydric, low stomach acid, and increasing it a little bit is going to make a big difference. So I like that. Peggy writes in, my husband is going cuckoo with his hair. Yeah, exactly. It is what it is. Not being able to get your hair cut when you're used to it. Especially a lot of people that need to dye their hair. That's a little bit more awkward, right? It's like, okay, you're half gray, half not, but hopefully this craziness will be ending soon enough. All right, couple more questions. What do you think about nascent iodine and hypothyroidism? Heard an interesting interview of Dr. Group. Have you heard of him? Yeah, Dr. Edward Group. He is the Global Healing Wellness Center, Global Healing Center. He's out of Houston, Texas. I'm familiar with Edward Group. My book on thyroid talks a little bit about this. Iodine can be a double-edged sword because so many patients or people have autoimmune thyroid. Sometimes giving iodine can throw gasoline on the fire. So if we do add iodine, it's going to be usually a month or two down the road. and we're going to make sure other minerals like zinc and selenium and magnesium are in first. We're going to make sure we've cut out gluten and grains out of the diet. We're going to really calm down a lot of the inflammatory triggers, because adding iodine can be like gasoline on the fire. And if we add it in at reasonable doses. We don't go into the 10, 20, 50x the RDA. We keep it at more reasonable doses, couple hundred micrograms, and then we work up from there. Always better to work it up versus throw a whole bunch in, throws like gasoline on the fire, and then you kind of have this issue where you make your autoimmune attack worse, and that has happened. But I do like nascent iodine. I think it comes in at like maybe 1 milligram or so per drop, which isn't bad. It's about 5 to 8 times the RDA. RDA is 150 micrograms, so you're at like 5 to 8. Not bad. You may want to start out with a half a drop and then work up from there, but you got to make sure all the other things are in place first. Hope that helps. Doing low carb and lowish FODMAP. Is there a test that won't break the bank terribly if you're not feeling better, doing all the good natural stuff? So it depends. Are we talking about digestive issues? If we're just talking digestive, then I would run a GI map test, and we'll put the link down below for that as well. That'll give you a good window, but a lot of people that have gut issues have hormone issues too. So if we just have digestive issues, and again, a lot of times you can have digestion problems, meaning an infection, but you have fatigue or brain fog or mood issues. So a lot of times there's not a direct correlation between gut underlying issues and gut symptoms. Sometimes there can be mood or mental emotional symptoms that aren't really directly connected to the gut, meaning parasite diarrhea, that's an easy connection, but parasite fatigue or parasite anxiety, that's kind of a weird connection. It's not like a common sense kind of thing. And so that test would be very helpful, a good quality GI map test. And then everything else after that, I'd recommend more diving in deeper. Okay, should I mention the person above has an immune issue, pneumonia? There are 3 times a year, possibly parasitic challenges as well. Yeah, so with someone like that, we'd want to look at the hormones. We want to rule out all the hormone stuff. We want to look deeper at the adrenals. Again, if they're female and there's cyclical issues, whether it's menopausal or just every month there's PMS issues or hormone imbalances, we want to look deeper at that. And then, of course, looking at the gut stuff is a big one. If we have chronic immune issues like 3 times a year pneumonia, I did a video that came out yesterday that talked about immune issues and the gut connection with the immune system. 80% of all your immune cells are actually in your gut. They're in your GALT, your gastric associated lymphoid tissue, that's in your stomach, and then your MALT, your mucosal associated lymphoid tissue, that's in your small intestine. So those are other areas where your immune cells live. And if there's stress in there from bad foods or infections or gut permeability issues, that's going to really stress out your immune system. What are your thoughts on a fecal transplant? It's kind of like a home run. Like you're trying to like call your shot. You're like, all right, I'm going to go all in on this. I've seen it be helpful for some people. I've seen some like it didn't do anything. It made them feel worse. You can't go all in on that, right? It's too much of a Hail Mary. It's like it completes so few percentage points at the time. I don't see it as like a big tool in my tool belt that I would go to. The foundational things are always going to be the foundational things, right? You can do some fancy stuff and you maybe get a home run every now and then, but it's not going to be a big needle mover. Changing the diet, looking for infections, fixing digestion, maybe cutting out more of the anti-nutrients in some of the plant foods, making sure your stress is manageable, you're chewing your food up well, you're not drinking and hydrating with your meals. Like the simple common sense stuff, it's not that sexy, but it works. And even if you have other issues even if you want to do the FMT, right, fecal microbial transplant, FMT, you still have to do the foundations. I'm a GI nurse practitioner, and we do fecal transplants for treatment resistance for C. diff with great success. Yeah, that's awesome. That's good. I treat C. diff all the time as well. And again, we use other herbs and we use other things like Saccharomyces boulardii and higher dose berberines and golden seal. So when you do fecal microbial transplant, where are you getting it from? And then are they doing a really good job in cleaning out? Because the last thing you want to do is get an FMT from someone that had Giardia or H. pylori, et cetera, et cetera. But, there's a scale and where you would add that in. That would be more at the later end when you've kind of exhausted all your other options. I've just seen too many of the other things that I do work more successfully at a higher level than I would jump to that at the end. I discovered I had acid reflux. What can I do naturally? I was prescribed pantoprazole, which is an acid blocker. I don't feel the heartburn, but feel swelling in the throat. So it just depends. You got to look at the root cause of the heartburn. Some people, their heartburn is going to be an indigestion of their stomach. Like even WebMD said it the other day. They're like dyspepsia. They said, look at gluten sensitivity or gluten intolerance as a cause of dyspepsia. I couldn't believe it. I'm like, wow. Like WebMD or Wikipedia, I think it was, which is really conventional, actually had put that in there. They'll probably delete it soon enough. But in general, sometimes it could be indigestion, right? Dyspepsia, not enough acid or proteolytic enzymes or pepsin in the stomach, right? It could be that. It could be foods irritating the gut lining like gluten and dairy. Could be that. It could be your sympathetic nervous system's on overdrive because of stressors in the environment that are shutting down your acid supply, right? It could be H. pylori that's lowering your stomach acid levels and creating inflammation in the intestines. It also could be SIBO and or SIFO, fungal overgrowth, bacterial overgrowth that's spilling up into the stomach area. It could be all of those different things. And of course, not enough acidity will make it so that esophageal sphincter, from your throat, where it dumps into your stomach, it doesn't tighten all the way. And so when it's loose, acid and stuff can move its way upward. So you have to look at all of those different things from a root cause standpoint. You're welcome, Carla. Little girl writes in, can't tell if it's hypoglycemic state, blood glucose level between 78 and 95 for 2 weeks. Had a big meal, low carb, high fat, protein, and glucose. Went to a whopping 79. That's not bad. That's not bad at all, but you'd want to just chart it, right? Like, okay, here's my fasting. Here's my 1 hour, 2 hour, 3 hour after the meal. And if you're at like 100 fasting, which is like, 4 or 5 hours post the previous meal, right? If it's like the afternoon, and then you went from like 70, well, that may be a little bit of a drop. So it just depends on kind of where you were and then what happens hour 2, hour 3. Doesn't sound that bad though. I imagine you're probably fasting before that may have been like 80, 85, right? So just chart a fasting 1 hour, 2 hour, and then 3 if it's not in a good place. But 78 to 95 isn't bad, especially if you're not feeling anxious or jittery and such, then it doesn't sound like a big deal. Okay, good. Hope that answered your question, Peggy. Advice on timing of taking HCl for stomach acid before eating. Do you do with shakes, with pea protein? Great question. Okay, so HCl and enzyme dosing or the timing of the dosing, I typically take them in between meals. Now, technically enzymes you can do before a meal, like right before a meal. Some people with gut issues, they can be a little bit sensitive even to that. So I like a little bit of food in the stomach, maybe a couple of bites to maybe a quarter way through the meal. That way the food lines the intestines and the stomach, so then when you take enzymes and acid, it kind of gets sandwiched in at the bottom and then more food stacks on top. So I like it like that. If you take it at the end of the meal, sometimes it can stack up and raise up a little bit and hit the esophagus. So I don't like it at the end. Sometimes you can get away with it if your meal wasn't really big. If it's bigger, then it may be higher up in your stomach. So typically with a little bit of food in there first, then take it. A little bit of water, don't down too much water. With a pea protein shake, I wouldn't take it unless you have lots of fat in there, like maybe you put egg yolks or almond butter, then I would maybe lean into an enzyme or two. It just depends what's in the shake. If it's just like coconut milk and water or coconut milk and pea protein, some berries, maybe just one enzyme is fine. You typically wouldn't need HCl with a shake unless you put a lot of really whole foods in there, egg yolks, lots of fats, some solid proteins in there, maybe like an avocado, then maybe you want to lean into a little bit of HCl, but definitely less because the blending and all that makes it really easy on your tummy. Okay, great. Hope that helps. And how to determine when you can wean off of it. So I always tell patients, get stable for like at least 3 months. Once you're stable for 3 months and you're infection free, and your hormones are relatively stable, then we drop things out. I always like to move things from a place of stability, not like, oh my gosh, like my cycle's finally getting a little bit better, like I'm sleeping better, like my digestion is starting to get better, and now let's start moving this around. No. We want to get things to a place of stability for about 3 months where we're relatively stable, we're infection-free, and then we can start picking things where we strategically taper off. Yeah, so no jitters on the lower blood sugar, no weirdness, no nervousness, but about 2 hours later, I get super cold. Yeah, so we need to look at thyroid and maybe other hormones, but it sounds like you're doing pretty good, but you could always do that fasting 1, 2, 3 hour and put the whole thing together. Is magnesium malate better for me in the morning or at night? It just depends how you respond to magnesium. Magnesium malate tends to plug into the Krebs cycle and help a little more with energy, but if you are one of these people that take magnesium and you feel more relaxed, then I think taking it at night is a better place to do it so you can promote relaxation, help yourself get into that parasympathetic mode before bed. If it overly relaxes you during the day and you want that edge so you're more focused, then just leave it more at night. If you do okay with it during the day, then take it during the day. That's totally fine. I have no problem with that. All right, great questions, guys. Joan writes in, love the way you explain things. I appreciate it. I shared all your COVID updates, promote the calm, and love these Q&As, learning so much. Awesome. Thank you so much, Joan. Really appreciate it. H. pylori, sorry for the spelling, came back negative. Okay, good. So it depends how you tested it, right? They probably just did a breath test, or maybe they did a scope and they didn't see it. So you really want to do a comprehensive genetic stool test to rule that out, because sometimes it could still be there. I had a patient last week, came back negative H. pylori on the conventional testing, and on the genetic test, she came back positive. So keep that in the back of your mind. Where can I be sure I can get real glutathione? Well, just get it from like tier one supplement companies. So if you need a recommendation, let me know. Quicksilver is really good. They have a really good liposomal glutathione. If you would like to get one from me, feel free and email office@justinhealth.com. We get them from Quicksilver, or we'll get them from Designs for Health, or for Special Label, or there's a couple other companies what we consider tier one, meaning they buy it from the highest suppliers, they buy the highest raw material, everything's independently tested for contamination. You want to do that. When you get cheap supplements, number one, they're usually buying lower quality ingredients, and then number two, they're not QAing it, they're not testing the quality to make sure it's there. So spend a little bit more from a tier one company. And then, of course, with my own line, I'm doing the same thing. All right? I'm buying it from the highest quality manufacturers you can. Right? When you're like buying CoQ10, you can buy it from China, or you can buy the expensive stuff from Germany, right? There's different grades in it. Great questions. Right leg cramping, especially at night, have been doing magnesium, potassium subs. Could this be something else? That's a good first start. It depends now on gut. It depends on what your diet is like. It depends on if there's any gut issues, but that's a good first start. Sam writes in, my wife's nose burns a little bit when nebulizing glutathione and NAC. Is there a reason for that? Well, I don't know about the NAC. I don't know about nebulizing that. I would just do the right glutathione and make sure you're using a very clean, like a saline solution, so it's, pH sensitive for the tissue. Maybe the NAC is making it too acidic, and maybe it's irritating the mucosa. Justin, when you're on AIP diet, do you use hormone therapy to boost energy since you're eating less carbs? I typically don't do AIP most of the time, so I'll still do some nuts and seeds. I'll do eggs like once a week, twice a week, and I'll do some butter. So I'm not fully AIP anymore. I've been able to reintroduce those foods, but I'm paleo 99% of the time. And if I cheat, I always try to do a healthy cheat. Like I had a little cheat on my wife's birthday last week. We did some white rice, which was fine in the sushi, but I don't do a lot of it. We did coconut aminos instead of soy. And then if we do soy, we do a tamari-based soy, or like a red fish oil, which is a soy replacement as well. So those are good options. I'll do a little bit of DHEA here and there. I was on those in the past when my adrenals were weaker, but I've gotten my adrenals to a place where I do very well, but I have my stack of B vitamins, certain glandulars, ashwagandha, or other types of adaptogen. So I have my own little stack that I kind of cycle through based on where I'm at. Thanks for your direction to nebulize glutathione. It's been great. Thank you. You're welcome. Yeah, definitely questions sourcing from China. Totally. What are the best binders? Best binders: activated charcoal, zeolite, modified citrus pectin, fulvic minerals. Those are good. Do you recommend sauna if one is dealing with severe candida problems? I mean, it shouldn't be a big deal for candida. Usually the sauna is going to really lean in and help when there's a lot more mold issues or heavy metals, but it would always help if it's a detoxification stress. And I like the sunlight in the sauna, and that's the one that I have in my office right down the hall there. Okay. Dr. J, Chris S. here. I do a neti pot daily when pollen is bad. I often get stuffed up. Are there other options for sinus cleanse? Yeah, do the Neomed or the Neti Xlear bottle where it really creates pressure, or you can use the Nasaline. It just creates a lot more pressure, and that pressure really pushes things out a lot better. The Neti Pot relies fully on gravity, so it only hits half to a quarter of your nasal canal, and there's not enough pressure to really break up crud that's stuck to your sinuses. You really need that good pressure. And do the Neti. I have a video on it. Type in Dr. Justin Marchegiani or Justin Health, like sinus rinse or nasal rinse, and you'll find it on YouTube. Friend was doing Xlear nasal rinse twice a day for a week, was getting better, but for the last couple of days became super congested. I'm guessing a change in food. Yep, if they changed their food, that could have done it. So if they added more dairy or sugar, that would definitely do it. Best fulvic minerals. They're in some different binder products. You'd have to go look, but there's one that I use called GI Detox that has a blend of them in there. Excellent. Let me just finish up here with you guys. Yeah, so Peggy, if you're looking to get extra testing here, feel free to email my office. We'd be happy to help you out, office@justinhealth.com. And there's different tests that we do the GI map to at least look at gluten, and it would also look at some of the parasites. And then within that test, they'll also look at fungus. But the organics is excellent because the diarabinitol that's tested there is a good way to assess fungus in the urine. So I like that. Hey, Kathy, hope you're doing well. Marianne writes in, from Denmark, could only find reduced glutathione here. How much to take and recommendations to additional supplement. I think 1 to 200 milligrams is probably fine. You can go up a little bit higher if there's more stress, but that's really good. And then if you wanted more stuff for like the COVID, you could add in some NAC or some extra vitamin C and vitamin D, and you'd be pretty solid. Hope it helps. All right, great. Lifehouse for any recommendations for low T that's not testosterone? So yeah, you could always do tribulus. You could always do Tongkat Ali. You could always look at getting the minerals looked at that help testosterone. So like zinc and selenium, if they're low, those will actually help boost that. Resistance training or burst training, of course, will help. And then you can also do ginseng is known to help. Eleuthero is also known to help as well. And then there's a couple of herbal formulas that are out there that are also really helpful. I said a lot of the herbs already. Horny goatweed's another one. Those are a couple really good ones there. That gives you a lot. Do you know the cost of removing mercury amalgam fillings on a single tooth? It depends. You can reach out to my personal dentist who does this really well. She's in downtown Austin. Her name is Dr. Joan Sefcik, Sefcik, and she's a biologically trained dentist. She's excellent, and just give her a buzz, and she'd probably be able to give you a quote. I want to say it's around per tooth, maybe around $1,000-ish, give or take, a tooth. Which one of your supplements is good for intestinal bacteria balance? That's a loaded question, because if you have a lot of bad bacteria, you may have to clean that out before you add good bacteria back in. So it just really depends on where you're at. You may need to work on the cleaning side, and we have the GI clearing herbs, but it depends on what kind of stressors in your gut there are. I have some baby silver fillings when I was younger. Yeah. So I would definitely look at strategizing. It depends on how many you have. Like if you have like 6, maybe you do 3 now and 3 at the end of the year. If you have 8, you could do it in 3 bites or so. So you may want to do it in smaller bites. That'd probably be a good way to do it. All right, guys, I got to jump on a patient call. Hopefully you guys are doing well. Have a phenomenal day, and I'll be back. Make sure you give me a thumbs up and comments below. Really appreciate it. Take care. Stay healthy. Bye.